Hello, Dr. Victoria Givens here with Givens Facial Plastic Surgery here in Austin, Texas, and we're going to be talking about nasal dressings after a rhinoplasty or nose job surgery. Now, I get a lot of questions about, do we have any dressings that are placed on the outside of the nose, and what about on the inside of the nose? So let's break that down because that answer is twofold. As far as dressings that are on the outside of the nose, common ones include a splint that goes around the bridge or that hard part of the nose, and then tape that goes around the tip of the nose and also the bridge. The reason a splint is placed on the outside of the nose is if we are trying to straighten the nasal dorsum or the bridge, or we're trying to build the nasal dorsum up or do any camouflaging in that area. As far as the nasal tip, if we're reorienting cartilages to improve or define the tip, you will have some tape that sits around the nose to give it some support and lift and just a bit of pressure to prevent any collection of blood underneath the skin from occurring. Those splints and tape stay in place for 1 week and it's removed in the office. It's pretty low maintenance. As far as the inside of the nose, different types of splints and dressings that have been placed inside. In general, I do not place splints inside of the nose. What I do is that if you are needing to straighten the septum, I'm going to pretend like this is that cartilage in the middle of your nose. If it is bent over to the side and we have to take that out, or the nasal air filters which sit inside the nose but on the lateral sides, if they're too big and are obstructing the airway and need to be reduced, if I'm doing either of those procedures, I do put a hemostatic gel inside the nose that does dissolve. I also will be able to suction it out at 1 week. It can, after your procedure, make you feel like your nose is obstructed for about a week until it dissolves or is removed. But in general, I do not need to put any splints that have to be pulled out of the nose. On very rare occasions, if we are concerned there is going to be any scar tissue that may build up between the septum that we reduced or the turbinates that we made smaller, a splint may be placed in the nose, and that can stay for a week or longer if needed. But again, that's very rare. Most of the time, there'll be a dressing on the outside and some absorbable gel that may need to be suctioned out on the inside. So I hope that helps. The recovery from a rhinoplasty really isn't very painful. It's a little more achy, but we'll get into that another time. Thanks for tuning in. And again, if you're ready to transform your life, it's time to call me at 737-787-8200. Thanks for tuning in.